Okay, I realized that there are a couple things that you might want to know that I forgot to bring up. And one is that today, for the first time, I haven't broken her skin. I don't even need to be wearing gloves yet, but good practice. I'm going to be using this product that we've talked about on the list. It's put out by After Inked, which is very well known for having a good aftercare ointment product. And it's called Pigment Seal, Skinful Beauty Pigment Seal. And so what I've done is I've put just a little bit like this into, I just have tons of these little plastic things. And then for those of you who don't, these pigments fall over. For those of you who wonder, I've already put a little bit of saline in this Dappen dish in case I make a whoopsie. So I wanted to show you the pigment seal. And the way to use it is let me get rid of that one. Just sort of as you wipe, using it with a cotton pad as your work. So I'm going to be trying that, even though it's new to me. All right, I need to do the surgical marker now. I forgot. I can't remember if I already said this to you guys. So, did I? About the retention situation. When the Beauty Angels pigments first came out, they did this video, and they were saying how you only need I can't talk and do anything at the same time. You only need to do one fill, and now I've since learned that that's not correct. You need to do 2 to 3 fills. So, therefore, she needs a lot of touch-up. More than I would expect of the clients that I had after I knew that to be the case. Her hair is growing like almost perfectly for the middle spine or middle connection line, as you guys call it. Sorry, different terminology. So I'm just going to dot that in there with my medical marker. And then I'll do the connection stroke starting right about here. And then I could right now put a little mark on her for when I get to the other side. So that is in about almost a centimeter. So I'll just put a dot there, is for the beginning of the or where the connection strokes will be. And I'm not going to, I'll be able to figure out the spine or connection line. Sorry, all these different schools of teaching. I can't keep language straight. And I'm opening now the tool. And that ring that I used on my tray is what I'll use when I do the machine, because this is a blade and shade. Okay, so I am going to be mixing the Latina medium brown, shaking it really well because these things get bubbly. And I'm putting in 2 generous drops. And I'm using my work pen that I always had right here, and I'm writing down 50-50, medium Latina brown, light Latina brown. Shaky, 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 shaky. And 2 generous drops of that. And then I'm using the micro brush with the tip cut off, and I'll continue to do that for this. I'll just keep stirring it. That helps with the dryness. And also looking through my surgical loops helps me determine that it's well mixed. All right.
So I have one question.
Yeah?
Are we doing the medium and the light?
That's what you said. You wanted the middle
Was that the middle one?
Yeah.
Okay.
Right.
Mm-hmm.
Now that I'm moving her, I realize I should...
Oh, shoot.
No, nothing bad happened.
Your phone didn't crack?
No, it didn't even fall. The only thing that happened was that they got to see how stupid I am.
Just edit that part
But
out.
I think they already know that. All right. But I just realized that because of the way I move around the client, these ring lights, you have to have the ring centered over a leg. Now, the way that I work, I have the client turn all the way from the this one word. The client's left brow, they turn toward me all the way. So I'm going to make sure that, yeah, you can't see much unless I move you, but then all you'll see is my hand and my head. I already know that. All right, and then I have in my hand, I have always a wet wipe, and in my fingers, a cotton pad. So her head strokes really faded quite a bit. Which is not abnormal. How is this?
Mm-hmm. Fine.
So I don't like to go too far without wiping and checking depth. The head strokes always fade first, and so personally I don't mind going a little bit deeper right there, but I'm not going to advise that. So you can't see this, but I'm checking depth by, she's not having any pinpoint bleeding, just the tiniest bit, but I'm stretching and seeing that the strokes are open. All right, now I'm going to go into the connection strokes. How are you doing?
Mm-hmm. Good.
Do you have any pain?
Mm-mm. I mean, I can feel it, but it doesn't hurt.
Okay. I realize my gloved hand is in your way too. It's really hard to videotape this stuff. So I'm getting the upper strokes in right now, just the main ones. And I'm trying to go with the one advantage of working with loops is I can see really well the old strokes, even though they've faded. So I'm trying to go in between them, but in this case, they all need to be refreshed too. So now I'm going to wipe everything and do the next strokes. I can just see better if it's white. Don't overwork the skin, just really gently. So in a normal fill situation, you would just be touching up the strokes that needed touching up. But since all of hers need touching up, that's what's happening. So now I'm doing the next level, or whatever you want to call it, of strokes. I'm using the Fee method, not the Beauty Angels method, because that's how I was trained. right before doing any more. See, I don't think this is really a good time to be using that color lock stuff because this isn't the main time that the pigment is getting deposited. Making sure the connecting line or spine is how I want it. There is just no way to do this where you guys can see everything. I don't know what they do. Well, in Oregon, we're not allowed to have anyone in the room except the artist and the client. So, yeah. When I want blood to stop, I just hold my wet wipe over it like this. And that usually will stop it enough that I can continue work. Since this is a blade and shade, I'm making the, see, that's a hair, I thought it was a stroke. The stroke's a little wider apart than I would if we were just doing microblading. Okay, so, you know, I don't think that this is really the best time, but I'm going to go ahead and use some of that pigment lock right now, because, you know, not that much pigment is deposited during the initial session, or the initial round. So I'm just going to take a cotton pad and dip it in. Okay, let me bring it over here. I'm just dipping it a little bit into this cup, squeezing it out, and then I'm just going to wipe the brow with it. Some of the pigment that was in her hair, most likely, that's what happens. The pigment gets stuck in the hair, came out, but that's about it. And now I'm going to apply a mask on her while I go work on the other side. When I'm do these masks, I use an eyeshadow thing, applicator thing. And I'll be refreshing this halfway through the other side, the other procedure, the other side. Now the other side, which has been sitting there without any anesthetic, I'm going to just refresh the anesthetic a little bit on here. And let that sit for a minute while I, for one thing, stir my pigment. That just brings all the stuff that's dried around in the ring off and mixes it up again, and it's not dry anymore. Okay, so this side has not been occluded, has not been sitting under anesthetic that long. Usually clients feel more discomfort on this side. And I don't know how, if you can see, but now I'm just removing the Zensa. You can't do this with just any anesthetic. I use the tip of the cotton swab to kind of dab at what's left behind because I need this dry so I can do the medical marker. And I can tell it's not dry. So I'm just gonna tap with my cotton pad. Still have to make sure that I can see the lines for the medical marker. Can I have a question about length? So I had measured the whole brow to begin with, and I know it's supposed to end right here. So because enough of the marker came off. But I want it to come to a tip, so just try to make that happen. She really wants to make sure that she doesn't have any hard angles and that she has rounding at the arch. So I emphasize that with the medical marker. So this is where the connection line, the connecting strokes will be, and then the connection line is like just a perfect medium or spine 6, depending on which vocabulary you're using. So I think you've seen enough, because I'm just now going to do the same thing on the other brow. So I'm going to stop this here.